Hi everyone again. Welcome to part 2 of my CME or RCME or Continuing Professional Development module on creativity. Part 2 is titled Exploring Creativity Past to Present. First question I have for everyone, and the first topic is what happened to creativity in education? So, with an increased focus on math, sciences, and literature, often creativity has gotten lost in the mix of things, per se. Creativity is often associated with the fine arts, and sometimes is neglected when there's just a focus on literature and math at a lower level education, or at a lower level of education, like elementary school. A second point that I brought up here is that the methods of admission selection have changed, and this really, I think, affects creativity in a big way. When we have extremely high GPA cutoffs for health professions programs, it makes me wonder, and I think rightfully so, what this does to a creative, divergent thinking person who maybe thinks outside of the box. So the second thing that I think I wanted to address is that methods of admission selection can negatively impact creativity and put us in a place where creativity isn't at the forefront of skills or abilities that are in a program. Third is the convergence of educational systems. I use this term to describe how in order to get through varying levels of education and get to the point where you're in a master's level, say health professions education, there's a lot of going with the program. And going with the program often sometimes doesn't leave room for thinking outside of the box and sometimes reduces you to convergent thinking often in the educational context. So the activity for this particular unit is, so you're going to have a look at this video that I edited and added some pop-ups into on insulin discovery. And I want to think critically about what it must have been like in the early 1900s when insulin was discovered, which is a Canadian invention, which makes it kind of extra fun to put this video in. I want to think about how it was discovered and how creativity played such a critical role in it. And particularly, I want to emphasize how innovation is intimately tied to creativity, and creativity is intimately tied as well to problem solving and working with what you have. And I think this video is interesting. It chronicles a little bit the history of the discovery of insulin. And I put some pop-ups in to sort of emphasize the points that frame it in a creative context. So pause this video, have a look at this link that you'll find within your PowerPoint presentation that's posted on the Edmodo site, and watch a video and think about how creativity was instrumental in insulin's discovery. Okay, so next I have assigned 3 readings. But I think they're really excellent readings. I've assigned 3 of them for this particular unit. They're not very long, but they're important and influential in the discussion of creativity, particularly in the medical education setting. I acknowledge that there are a lot of people from a variety of backgrounds, and that we don't have a lot of literature in some of these fields. So medicine is a field that we lean on most exclusively for research into creativity, especially because there's such a sparse research base, as we discussed in Lecture 1. Okay, as you go through these readings, I want you to think about convergent thinking, which we'll address later, which has to do with concepts coming together, or narrowing of thinkings and bringing a bunch of related concepts together, as opposed to divergent thinking, which is radiating out from one idea. My second question for directed reading is how does creativity impact the art of medicine? So how do you think that creativity is tied to what we describe often as the art of medicine, or that je ne sais quoi that comes with excellent clinical practice? Third directed question for the reading is how does creativity underlie other cognitive or interpersonal abilities? So, for example, I think from the readings that creativity underlies innovation, and I'm wondering if you can draw some other key terms from those readings. Okay, now that you've completed the readings and you've thought about those questions, I want to talk a little bit of dimensions of creativity, and for this I'll be leaning from some course notes that I have from a course in creativity that I took with Dr. Andrews at the University of Ottawa. So he he discusses, as well as does Starko, who's a writer on creativity as well, 4 dimensions of creativity: the person, place, process, and product. And I think this is a really wonderful way of conceptualizing what's going on with creativity. Sometimes we focus exclusively on the product, or we focus exclusively on the process, more so on the product. Sometimes we neglect culture and we neglect the actual individual. So I think each of these dimensions is very important when we consider how we conceive of creativity. In particular, I want to draw your attention to divergent versus convergent thinking, which we discussed before. These are really hot topics in creativity, and they really define, divergent thinking really defines an aspect of creativity. So when we think back to lecture 1, when we talked about originality, divergent thinking is a good way of conceptualizing original thinking, or thinking that's radiating away from an idea and working towards new things. Here we have described with the product, preparation of a product, incubation, which is thinking about a product, then drafting it, trying it out, and then finally trying it out and editing it, and then rehearsing it. So these are 4: the person, the place, the process, and the product are 4 dimensions of creativity. There are many theories of education that touch on creativity, and this list is quite long and exhaustive. I personally have taken out 2 realms, or 2 types of theories that exist in education or in psychology that both discuss creativity. The first is constructivism, and Vygotsky, as well as Piaget, but I'm going to put emphasis on Vygotsky, are attributed to the underpinnings of constructivism. And in constructivism, we conceive of each person constructing ideas themselves, not as information coming into the brain, but instead of them interpreting and giving their own personal meaning to learning experiences that's contextually specific for that person. And part of what's discussed in constructivism and Vygotsky is the creative learner. And one of the main tenets of how we learn has to do with how an individual gives meaning to their particular things, and in doing so and being able to give meaning to things, one has to be creative. So I think this is a very important point to bring up when we discuss creativity, just from an underpinning point of view. The second type of theories that I'd like to discuss are humanistic theories. There's many, but I've brought out 2 particular theorists. One is Rogers and one is Maslow. Rogers is most famous for person-centered, client-based therapy and psychology, and he discusses creativity as an important tenet of well-being and fulfilling living. And then Maslow, on a related note, discusses self-actualization, and in particular, you'll find that in the readings they discuss how leading a fulfilling life, and what he describes as self-actualizing, is contingent on being able to express yourself creatively. So I think that these are interesting, important theories that underlie how we can think about creativity in an academic stance. All right, so this is all we have for part 2, which is exploring creativity from the past to the present and beginning to think about it critically and frame it within our health context.